Welcome back. Call this meeting to order at 9:32. This is a work session on the County Health Department Annual Report. First item on the agenda is public comment. Does anybody from the public wish to make comment this morning? I see none. With that, I believe I'm welcoming Dr. Adam London, Health Department Director. Good morning, Adam, and the floor is yours. Actually, before the floor is yours, I just remind everybody we're doing this, something new we're doing this year for some of our bigger departments. We did this with Sheriff, we're going to do it with Clerk, and we're doing it with Health Department today, just to give a little bit longer opportunity for question and answer. You guys meet a lot of our public in person and have a big team, so want to give you a little bit extra time. So the floor is yours. Thank you, Dr. London.
Different than what the people may think about the role of County Commission. One of the responsibilities of the County Commission, and it's something set forth in state law, is the responsibility for public health. And the requirement that every county or district of counties has a health department that carries out the services mandated by the state of Michigan. And also that every county has two positions: the health officer, which is the executive of that health department, carries out those mandated services and the powers and duties that they set forth, the state does, and the medical director, and that's a physician. Dr. Kristen Oldenburg is our medical director for the Kent County Health Department, and her responsibility is overseeing all of the medical services that we provide. We really can't provide any medical service without having a physician on staff to direct those things, and she's also an important part of our team and someone who helps advise and counsel us as we wrestle with new and emerging issues and all of the challenges of the day. But of course, the role is much larger than the two of us, and it's a team. And I'm very thankful. I think the people of Kent County are blessed to have an extraordinary team at the health department and here serving Kent County. Today, the way we're going to approach this is I've invited my senior leadership team with me today. They each have a couple of slides they're going to present on over the areas that they oversee. They're going to tell you a little bit about some of the programs in their division area, along with some of the performance measures for the past year or two. You should see their contact information. I think Rob distributed a list of contacts. It's really important to me that all of you feel empowered, encouraged, invited by me to reach out to any one of us. If you have an issue with a constituent, a question, something you'd like to discuss, please, I want you to know who they are and feel comfortable reaching out to any of them. So that's our approach, Chair Green. We're going to go through each of these areas with a couple of slides with some measures and an update. But of course, we're here at your pleasure. So if you'd like to intervene and take us in a different direction, please, you are more than welcome to do that.
This is great, Dr. London. Please proceed, and if you guys find natural places for us to, if you want to pause and ask if there's questions, we'll do it that way, or else we can wait till the end. So, great, thank you.
And like other departments with their measures, of course, we're going to go over some alignment with your priorities. We're going to talk about some of our performance measures, some accomplishments, and look ahead, especially at some significant issues or challenges that we're watching carefully. This is not my slide. This is actually a screenshot of your recently created strategic plan for the coming years. And this priority, I think it's a third priority, which is high quality of life. And I really appreciate the fact that you have in that goals and objective area, item number 2, which is addressing existing and emerging public health and environmental concerns. I think you'll see that through our presentation today, that we're working hard to advance this priority for the county. And also please know that as we enter our next phase of department strategic planning later this year and early into next year, as we get our community health needs assessment results back, that we're going to be framing our strategic plan to closely match your leadership here with this priority. And I'll turn it over to Dr. Oldenburg.
Good morning, everyone. It's really exciting to be here today, to be able to share some of the wonderful work that we're doing at the Health Department to support our mission, which is to serve, protect, and promote a healthy community for all. And if you're looking at the slides, you probably noticed that serve and all are both underlined, which just is because we want to emphasize that our mission is to serve the entire community of Kent County. So with that, I think we can go on to our next slide. Oh, sorry, I have to do it. This is just a brief summary of the Kent County Health Department, which was established in 1931. So our programs fall into three general categories, the first of which, like Dr. London mentioned, are those services that are mandated by the Michigan Public Health Code, including immunizations, food safety, drinking water, and wastewater, as well as hearing and vision screening for children, infectious diseases, and AIDS and STI services. Secondarily, we also deliver many state contracted programs with the board approval, such as many of our family services, like the maternal infant health program, as well as inspection services for facilities like campgrounds, public swimming pools, body art facilities, daycares, as well as other services such as WIC or Children's Special Health Care Services. And we also deliver, beyond that, some discretionary programming, which is directed by the needs expressed by the community as well as the board's priorities, including things like our lead program or other inspection services or Strong Beginnings or Nurse Family Partnership, which are both additional supplemental home visiting programs. As you all probably know, we have 4 locations which are strategically located throughout the county so that more of our community members are able to have ready access to our services. Our health department is fully accredited both by the state of Michigan and the National Public Health Accreditation Board, and we are really proud to say that Kent County ranks in the top quartile for Michigan counties in terms of county health. As mentioned, we have 5 divisions, and you're going to hear a little bit from each division this morning. So at this point, I am going to turn the presentation over to Gail Brink, who's going to tell you a little bit about what our administration division is doing.
Morning, Gail. Nice to see you.
Good morning. Yeah, I am one of the 2 deputy health officers with Carla Black, and so I'm going to go through, let's see here. Which one do I do? Oops, wrong one. Which is that? Oh, sorry. Is it? Oh, that one. Sorry. All right. No, that's just moving it over. Why is it not? Is it this one? Oh, there. Sorry about that. I'm going to go over the areas that I oversee and I am responsible for. The first one being community clinical services. That is, the division director there is Christopher Medecki. He's not able to be here, but Amy Shears is here, and she'll talk a little bit more about that later. The second is community wellness. That's overseen by Christina Palawata, one of our other division directors, and she'll share information about that too. And then the next area is finance. And in there, there's 4 different kind of high or main areas that we are responsible for. One is the budget, one's financial reporting, we have grants and contracts, and we also have Medicaid and insurance billing. Under the budget, we prepare the annual budget according to the parameters given to us by county administration and approved by the board. We do that once per year in that process. We also do mid-year budget adjustments. As you know, if we have a new grant or something, we come to the board for approval, and then we do an additional budget adjustment and appropriation to that. And that happens at any time throughout the year. As our budget total is $43.2 million, and on the next slide, when I get to that, I'll kind of break that down a little bit between revenues and expenses. Financial reporting, for the most part, that's financial status reports that we provide for. We have over a little over 90 different grants that we report on, either monthly or quarterly. All of those grants are reimbursement grants, and so that means we incur the expense first and then do all the reporting to the various agencies and then receive reimbursement for that. The next area is grants and contracts. We do have a grant administrator who assists our staff in writing for new grants. He's also in charge of contracts. We work with purchasing and legal to make sure that we have contracts and agreements for all the services that we provide. And then last is Medicaid and insurance billing. We bill Medicaid, Medicare, and private insurance. And I'll talk a little bit more about that breakdown of how much we do for Medicaid and that when I get to the next slide. And then the next area is IT. We have staff there because we do provide Medicaid or medical services and we bill for those services. We're classified as a HIPAA-covered entity, so we have to make sure that we have certain policies and procedures. We have annual assessments of our security systems that we're required to have and training for staff. Also, because we bill Medicaid, we have to comply with the waste, fraud, and abuse part that comes, I think, started back from the Deficit Reduction Act in 2005. That requires us to have training of staff in specific policies as well. And then staff technical support, we have about 265 FTEs, most who work out in the field or remotely. So that requires a lot of support from, our IT staff to those staff out in the field. Then the last area there is administrative support. That's just, we have 4 staff there that support administration. We do medical release. We do some FOIAs. We do, that would be our main phone line support. And we do some shipping and receiving out of those. Then the next slide, I'll just give a little brief. This is based on the audit from 2025 actuals. If you look at the revenues, you'll notice over 54% of our revenues come from federal and state grants. As I said, we have over 90 grants. We have $12 million come to us in federal funds, $7 million in state grants, and $2.5 million in private grants. We don't have currently any direct federal grants. Most of that comes to us from the state as passed through. And we have one large comprehensive agreement with the state of Michigan that covers most of the services we provide. Grab some water in my mouth. Then reimbursements. This is where the insurance reimbursements are. We bill private insurances about $500,000. The rest of that is all Medicaid. That is either direct billing, that includes direct billing that we do for that, as well as the annual cost settlement that we do. That's an attempt to try to reimburse us for our actual costs. So that in itself with Medicaid is $7 million. And that represents just under 20% of our budget. Charges for services, that's fees that we charge for things mostly in environmental health where we do inspections and permitting, also immunizations when we provide immunizations for the private pay citizens. They come in and they are charged a fee for that. And then the other main area, just under 20% comes from the general fund. That's the county appropriation that we get for the operations that we do, and that's a little over $7 million. If you look at the expense side, as I said, we have 265 FTEs, about 285 staff actually. 70% of our budget of the expense budget is personnel-related salary and fringe costs. There's also contractual services, that's about 22%. Just one thing to highlight in there, about 10% of that, 8 million or over 800,000 is for interpretation services. Because we provide services and we bill Medicaid, we're required to provide interpretation services for staff or for clients that need that. And so that's a big chunk, or not a big, or a vast majority of that, of 10% of that is related to that. Supplies, that's 7% of our budget. That's mostly related to operating supplies, medical and safety supplies. One of the big things is the purchase of vaccine for the private pay. We have to purchase that vaccine, and those vaccines are very expensive, so that's the vast majority of that. And then we have a small amount for capital outlay. That includes computers, building costs, and other office equipment. And with that, I will turn it over to Carla.
Good morning, everyone. I'm Carla Black. I am the second half of the dynamic deputy duo that Gail mentioned. So as part of my team, I have 2 divisions, 2 programs, and 1 lone epidemiologist. So the 2 divisions that fall under my team are community health strategy and environmental health. And so Brian and Sarah will be talking about their divisions here in a few minutes. So they'll talk about that excellent work then. But where I'm going to focus today is on communicable disease, emergency preparedness, and also my lone epidemiologist. Communicable disease is run by Kathy Armstrong, and she's just an absolutely fantastic person, and I hope if you ever have any questions that you can reach out to her about communicable disease. Communicable disease is one of the most important things that is kind of outlaid in the public health code that we are responsible for. So any diseases that can be transmitted from human to human, we need to be on top of so that we can stop any sort of spread from happening. Currently in the state, there are approximately 85 diseases that are reportable to the health department. These have to be reported within about 24 hours. And that is so that our team can start the investigation to try to stop some of that spread to make sure that we're not impacting any more people within our community. And where our epidemiologist comes into play is that our new epi, Madeline Monroe, is actually a part of our communicable disease team, but also she serves the whole department as well, because we actually have 5 other epidemiologists, but they are assigned to other specific parts of the department. So she's helping out in communicable disease, but also serves like the whole department in some of our much bigger efforts. And one of the really interesting things that she's been working on, and I'm really proud to show, is that we have a new communicable disease dashboard. And the thing is that when we started preparing for this talk today, what could I have shown you in terms of communicable disease? There are so many numbers. There are so many numbers. And so one of the really big benefits of having Maddie on staff is that she is our dashboard expert. And so she went back to 2020 and started putting together a dashboard to look at all of those reportable diseases that have been here in Kent County. You're able to take a look at those through the lens of foodborne disease. You can look at them through STIs, let's see here, respiratory diseases, vaccine-preventable diseases. So I highly encourage you to go take a look at that website. It's actually listed on the bottom of the slide, but if you need assistance, be happy to help you to see where that's at. But this is available to the whole community. It's been a great benefit to our partners to be able to see this and be able to look at the trends as diseases come and go throughout our community over the years. The second thing I'm going to focus on today, though, is also emergency preparedness. This program is near and dear to my heart, as I was the preparedness coordinator for 10 years before taking this role 4 years ago. As you think of emergency preparedness, you're probably thinking of like people just running out into the field and jumping in and trying to make sure that everything's okay. That is a part of it, yes. But on the day-to-day, what they're really doing is they're out collaborating. And they're collaborating with our hospital partners, emergency management, both in the local level at Grand Rapids, Kent County, at the state level, and also working with a lot of our nonprofits. And so really trying to get people collaborating for emergency preparedness and being ready for things when they happen here in our community. The other big part that they do on the not emergency basis is education. And one of the programs that we're really proud of in this area is our inclusive preparedness program. And this has been going on for nearly 10 years, where we teach people of all abilities in our community how to prepare for disasters. And this is a collaboration with a number of our partners in the community, including fire departments, the National Weather Service, the American Red Cross, and others, to make sure that people know how to do hands-only CPR, be able to deal with fires in their own homes, and also do basic first aid and know how to deal with weather as it comes, because last night was a true testament of that, and we're probably going to see some more of it tonight, so be ready. But finally, there is that response piece. And it's not always just, the really big things. There's also some of the things that are starting to emerge more and more now. For example, measles. And we worked with Amy with our vaccine team, because we had a case of measles last year in which we had to distribute vaccine. And so working with that immunizations team, we were able to get people immunized that chose to do that. And so there's a lot of really good work in these areas. And again, feel free to come reach out to talk about us to any of those things. So with that, I will turn over to Amy Shears to talk about our clinic services.
All right. Good morning. I am Amy Shears. I am the Immunization Program Supervisor, so thank you for allowing me the opportunity. We will be going over our community clinical services. We do have three major programs, the first being the WIC program. So we have 92 staff within our division. Those are comprised of clerks, medical assistants, public health nurses, registered dietitians, and then our division management team. Through fiscal year 24-25, we did provide approximately 52,000 clinical appointments, all right? So for WIC, that WIC program is a supplemental nutrition program for pregnant individuals, infants, and children through the age of 5. Our staff are trained to provide nutrition education, breastfeeding support, and a plethora of community referrals. That is their main thing. Make sure our clients are tagged up with the services that they need in the community. Through this, over $9 million has re-entered the local economy through those food purchases that are WIC approved, all right? Our nurses will complete an oral health screening and talk with the parent or guardian about fluoride varnishing. We can provide that right at the same time. Also, we do complete lead testing. That is required to be completed for children at 12 months of age and 24 months of age, which we can do a capillary assessment of that. And then if we need to escalate that, we can do a venous assessment of that to get a bit of a deeper dive into what that level looks like, okay? In our immunization program, we provide vaccines across the lifespan. We do a lot of education and recommendations for those that would like to travel internationally and come speak with us. We discuss routine, recommended, or sometimes required vaccines to enter those countries. Our nurses also will discuss how to keep them safe while they're there. Food and water, insect precaution, a plethora of information to keep our community members safe while they travel abroad. We also provide waiver services, which is no longer the term that the state of Michigan has us using. It is now called non-medical exemptions. So families that choose to receive those will come and speak with our nurses and get that completed so that there's no barriers for children entering childcare or school programs. All right. In our personal health services, we have STI testing and treatment. Our staff there can provide confidential testing and counseling for gonorrhea, chlamydia, and syphilis. Our HIV testing and support services is also very confidential, and that testing also will lead to personal referrals to some of our specialists that'll help get those clients to treatment or further community services. For PrEP, or pre-exposure prophylaxis for HIV, that is an evidence-based prevention program that is provided to those that may be at increased risk for contracting HIV. Studies for this treatment and prevention has shown that it will decrease the likelihood of contracting HIV by 90%. And then we have our friends that work in the TB clinic. So they are providing TB tests, treatment, diagnosis, follow-up, direct observation treatment, just a wide range of activities to make sure that to decrease the spread of TB in the community. All right, this next slide goes over some of our program numbers over the last couple of fiscal years, and I do have some projections for the next fiscal year. So for our WIC program, our numbers have remained relatively stable over the past several fiscal years, averaging about 33,000 appointments annually. For this fiscal year, 25-26, the annualized numbers are showing a modest decrease of about 6% for that program. And sometimes these fluctuations can be attributed to broader economic issues, demographic, employment changes, or trends, and birth rates, okay? Regarding our immunization numbers, we continue to provide about 11,000 to 12,000 appointments annually or through the fiscal years. Over the past decade, these service volumes have fluctuated, but they've all, they've gone down, they've come back, gone down, come back up, with periods of increase and decline. Okay, in general, the most significant changes have been related to appointment numbers for the community during disease outbreak, specifically like Mpox, measles, COVID, and also depending on the severity of the seasonal influenza season, all right? Our travel immunization demand also fluctuates. As my daughter says, if it's not TikTok approved, we're not going. But hey, that's that generation. But those numbers can be, they can fluctuate based on destination civil unrest, outbreaks, anything that's going on in those areas that our community wishes to travel to. Our STI and HIV PrEP program, we are forecasting little to no change in services over the next fiscal year compared to 24 and 25. You will see a bit of a change between 23, 24 to 24, 25. And what we can attribute that to is our Fuller remodel. We did have to move that clinic into a substantially smaller space during that remodel project, which did decrease our ability in the number of people they could see on a daily basis. But we are back in our brand-new, very beautiful clinic, so hopefully staff can accommodate more faces and more community members. All right, and I will turn it over to Christina. Thank you.
Hello, everyone. My name is Christina Palawada, and I'm the Division Director for Community Wellness. So the Community Wellness Division employs approximately 80 staff members and includes 10 programs. And most of our programs focus on the health of women and children. So today I'll be focusing on our largest programs, which are home visiting and hearing and vision screening. So these programs not only include most of our clients, but also employ the majority of our staff. So hearing and vision screening is a mandated service by Michigan's Public Health Code, and it requires that children receive hearing and vision screens during the preschool years, which are ages 3 to 5, and also prior to kindergarten entrance. Then after school entrance, hearing screens are conducted in grades 2 and 4, and also vision screenings are then done in grades 1, 3, 5, 7, and 9. And part of the reason vision screenings are done in grade 9 is to prepare children or students for driver's education. And also these screenings are done to detect hearing and vision issues early to minimize the impact on growth, learning, and development. So the screening process is actually a 3-step process. So children receive the initial screen, and then if abnormalities or issues are detected in that initial screen, a follow-up screen is done. If there are issues or abnormalities detected in the second screen, then the child is referred for follow-up services. And all of those referrals are tracked and monitored by hearing and vision techs at the health department to ensure children get the care that they need. And then we also have 3 home visiting programs in the division: Nurse Family Partnership, Maternal Infant Health Program, and Strong Beginnings. So all of these programs focus on improving maternal and infant and child health outcomes, but they vary based on the intensity of services, duration of services, eligibility criteria, and also the type of home visitor that the family receives. So for the Maternal Infant Health Program, that program serves families who are Medicaid eligible, so it focuses on pregnant women or families who have children under the age of 12 to 18 months. And home visits are provided by either social workers, registered nurses, or dietitians, many times a combination of the 3, and it's based on the client's needs. So typically, visits wrap up by 12 months after birth, but for families that have additional risk factors or additional needs, those visits can continue until 18 months after birth. And then Nurse Family Partnership, that program focuses on first-time moms who meet income criteria, and also those moms must enroll before the 28th week of pregnancy. And the reason for that is because it's a very research-based, structured programs, so we want to make sure that our families get the duration and intensity of services required. So those visits are provided by registered nurses who complete a comprehensive training curriculum that prepare them to do these visits, and visits are conducted until the child's second birthday. And then lastly, Strong Beginnings. That's a program that is offered to many of our families in the MyHIP or MIHP program. So those are families who have additional risk factors, typically complex medical, mental health, or unmet social needs. So they qualify for additional visits conducted by a community health worker who has lived experience. And those visits are conducted based on the family needs. So sometimes families get weekly visits, sometimes they get twice-a-month visits, and they continue until the child is 18 months of age. How do I advance the slide? So this one? Oh, there we go. Got it. So in terms of the number of screenings and visits that we've done, it appears that there's been a substantial increase from fiscal year '24 to fiscal year '25 for hearing and vision screenings. That is actually not the case. What gets lost in these numbers is that we're tracking by fiscal year. When we track by school year, which is August 1st through September 31st, the numbers are pretty stable from year to year. But when we track by fiscal year, we sometimes track schools who have their screening in August of one year and October the next year, and it crosses that fiscal year, so the numbers get a little funny. The number of home visits, and that includes the home visits conducted with all three programs, have remained relatively stable for the past few years, but we are anticipating a slight decrease for the current fiscal year, just because we're getting fewer referrals. So now I will pass it off to Sarah Simmons, our Director of Environmental Health.
Hi, just a second, I want to set my timer. I kind of was strategic in how I was going to do this, so I want to make sure I maximize my time. So, hi, my name is Sarah Simmons. I'm the Director of Environmental Health at the Kent County Health Department, and I'm very excited to be here and talk to you all about something I'm very passionate about, which is the Environmental Health Division in the Kent County Health Department. Our team is made up of 56 staff members, clerical, sanitarian specialists, and epidemiologists, and supervising sanitarians. Let me turn to my slide. Within our division, we provide services to the community through 19 different programs, but today we're just going to focus on 5. And they are the water well and septic program, which tend to be kind of married, so I lump them together. The food safety program, body art program, public swimming pools, and lead. So we're focusing from left to right. With the well and septic program, you can see that we, in FY25, we have seen an increase in services in the well and septic program. This is a win, especially when we're seeing a decline in well permitting because of the extension of water. So that helps us give us an indicator of what's going on in housing and what's going on in people investing back into their homes with repairs through correction of septic systems. The well and septic program include housing complaints, home repairs, well and septic complaints, permitting, site evaluations, and the evaluations of site condos and subdivisions. What I'm really excited to tell you about today is that in FY25, we only had 3 subdivision site condos plan reviews come through our office. Today in FY '26, we had 9. That's 270 lots that will potentially be buildable for our community with new housing. So it's a huge win, that I think that's a really good indicator for us in terms of what's going on with our local economy. That's kind of how we think about it in environmental health. Moving on to food safety, we are really, you notice that in FY '24, we had a higher amount of services I'm sorry, I don't have my glasses on, so I can't read my numbers very well. So I'm going to give up, and I'm going to talk broadly. We had higher numbers of services in FY '24 than we did in FY '25. And the reason being is that we've seen a real change in the way that people are providing food to our community in terms of food establishments and the way they're preparing food. So the food safety program, we evaluate and audit fixed restaurants. We also evaluate food trucks and do food audits on food trucks, temporary food establishments. So that's going to be like your people that are selling hot dogs and maybe it looks like they got something going on down here. So our staff will probably be out there today. And complaints. I do know that our complaint numbers were down last year, so that might be a difference in that. But what we have seen is an increase of migration from what we call temporary food establishments to food trucks. So we have a lot more food trucks now than we do temporary food permitting. So that might be a little bit of a difference in the numbers this year. This year, I'm really excited to tell you that we licensed 2,713 food facilities for our community. And what we've been able to document over time is that we're looking at a 3% increase in restaurants coming into our community over the last 5 years. So we're steadily growing our restaurant community, so we can come back and say that, after COVID, we are rebounding, and we're rebounding well. The Body Art program, I'm not sure how many of you are familiar with the Body Art program, so I threw that into the mix just as an informational. Body Art program came into the purview of the health department in 2010 through a state law. We license body art facilities, we do not license artists. And since the time of that program's inception, we have tripled in terms of volume. And body art by law includes piercing, tattooing, scarification, branding, and I think that's it. So things that can actually harm you, and a lot of concern in terms of public health about that program and how it's managed. So I'm very happy to say that that's a growing program. The community is doing really well. They're doing an outstanding job with compliance. And then just to highlight that for the 3rd year in a row, we've had the Grand Rapids Tattoo Festival right across, I'm getting geographically challenged, the DeVos Place, that way. At DeVos Place, and within 10 hours, we were able to license over 104 temporary body art facilities, so it was quite an achievement. I'm going to speed up because I'm getting over my time, but swimming pool program, that's something that we do annually. We inspect public swimming pools to make sure water clarity, safety features are in place, in that people are not being burned by chemicals. And then lastly, lead. We've seen an increase in 2025 in services, but unfortunately, we're starting to see a little bit of a decline in 2026, and that's largely due to cancellations. In the reasoning behind that, I don't want to speculate. I think there are some people that do have continued fear of loss of housing if they let people into the home for the inspections. But the lead program does include not only lead inspection risk assessments for children that have been poisoned by lead, but we also do home health screenings, which is a voluntary program that allows us to enter into the home to be able to inspect the home for lead hazards, asthma hazards, as well as physical safety hazards in the home, and get them corrected before there is actually a child to be harmed. So with that, I am going to wrap up my portion and hand it over to my colleague, Brian Artle, who I'm sure will have a lot of great stuff to tell you.
Oh, you're setting me up for failure, Sarah. Good morning. My name is Brian Hartle. I oversee the Community Health Strategy Division at the Health Department. We're a relatively small division with 17 employees, separated into 2 sections. One of our sections' main role is to bring together community partners to identify strategies to address the health needs of our population. And one of the ways that we identify those priorities, health needs, is through our community health needs assessment, which is done every 3 years in partnership with our nonprofit healthcare systems. And the CHNA really involves summarizing data from multiple sources, conducting several surveys and focus groups in partnership with community organizations who collect information from the populations they serve, and we provide them with stipends for those efforts. During the 2023 CHNA, over 5,500 people from Kent County participated in those data collection efforts, and we made a real progress in raising the voice of people who are often unheard, different populations like those who are unhoused, those who are previously incarcerated, and those from several different populations who call Kent County home. 2026 is our next CHNA, so you'll be hearing a lot about that this year, and we hope to improve those numbers in the coming year. So once all that data is collected, what we do is we summarize them into the top 10 health issues that come out of that. And we bring those same partners together to prioritize those issues and come up with the top 4 priorities that are then moved forward to our Community Health Improvement Plan, or CHIP. And what the CHIP is basically a strategic plan for the community where partner organizations can take on part of that, take upon the responsibility for addressing those priority health needs, including our health systems, which all build their own implementation strategies that they take forward to drive their work in the coming years. We do bring community voice to the health needs assessment through our Health Equity Council, which is made up of 10 different organizations who serve different populations in Kent County, as well as 10 community members who come from different geographic areas such as neighborhoods and zip codes. The funding for the Health Equity Council comes from the Michigan Department of Health and Human Services, the Michigan Health Endowment Fund, and the W.K. Kellogg Foundation. And one of the great things about that is it's able to bring dollars to the priority health needs and bring mini grants to our community. So over the past 4 years, we have provided $580,000 to 59 projects that are implemented by these community-based organizations to address the community health needs. Last year, we provided $55,000 to 5 different organizations who addressed housing and access to healthy foods. We also helped to convene the opioid task force, which focuses on reducing overdose deaths due to opioid use. That group involves law enforcement representation, those from health systems, behavioral health systems, as well as pharmacies. So we bring those folks together on a quarterly basis to talk about strategies to address those overdose issues. One of the things that we do is oversee the use of the opioid settlement funds, which provide funding to organizations here in our community, like the Grand Rapids Red Project to distribute naloxone boxes in our community, the Arbor Circle, who has peer recovery coaches that help people with their recovery journeys from substance use disorders, and the medication-assisted treatment program at the Kent County Jail. Right now, the task force is involved in developing proposals for the next round of settlement funding, the 2-year spending plan. And you'll hear more about that, I think, in the educational session at the end of this month. We have 2 staff members who work with the Healthy Eating, Active Living Task Force to improve access to healthy food and physical activity opportunities. That does involve some funding from a grant in the Roosevelt Park neighborhood to support activities such as their community garden, some walking clubs, and a farmer's market. Finally, our Healthy Kent group collaborative focuses on improving birth outcomes and reducing suicide in Kent County by focusing on mental health. So the Infant Health Action Team actually consists of 7 different work groups that focus on topics such as breastfeeding, safe sleep, and the importance of involving parents or fathers in the lives of their children. Our other section is our health education section, and that includes 5 health educators who provide educational programming to students across Kent County. All of these programs involve talking about risks of substance use, as well as helping students to build their refusal skills to help prevent their use of substances. The Botfin Life Skills Program is our largest program. That's an evidence-based program for kids in grades 3 through 10. In addition to substance use, it also covers topics such as anxiety, dealing with stress, and how to build healthy relationships. Our Yo Puedo program is similar, but it's for middle school and high school students, and that is offered both in English and Spanish, so that meets a need there. Catch My Breath focuses specifically on the dangers of vaping or electronic cigarette use. Our alternative to suspension program really provides students the opportunity to stay in school after they are found guilty of violating a school substance use policy or smoking in the boys' room, something like that. So we provide that opportunity for them. The Signs of Suicide program really helps students understand mental health challenges and encourage them to acknowledge those challenges and seek help when they face those challenges. Finally, our peer-to-peer youth leadership program really empowers those youth to be the leaders and to talk about and encourage substance-free use or substance-free lifestyles among their social networks. The one thing that we do also in partnership with the Kent County Sheriff's Department is we go out on compliance checks to ensure that retailers are not selling tobacco products and vaping products to youth who are underage. So they go out there and check. They have decoys that go into the retailers, try to buy these products. And in the last fiscal year, we did 120 of these checks, and 15 retailers failed that by selling to underage minors. And so those retailers either get a fine or they'll get education of their staff to help prevent future violations in that. So that's all for me, and I'll turn it back over to Adam.
Thanks, Brian. So we had a wager behind the scenes as to whether or not Brian was going to break out into singing Smoking in the Boys' Room or not. He's known to do that sort of thing. So that's a quick tour of the Health Department services. The last slide we have is just a quick one on some significant issues and opportunities that we're looking at. The first is that communal needs assessment that Brian mentioned. And you should have received I think it's a 4-page summary of that needs assessment. We will be leaning on you and asking you for your help in pushing that messaging out to your communities. We really want to get people to respond to that survey, respond to the prioritization exercises that we're going to bring forward so that we hear broadly from every corner of Kent County. Medicaid and healthcare access.
Regarding Medicaid, we're working collaboratively with partners in our community like the healthcare systems and the federally qualified health centers to deliver messaging to the community regarding the upcoming changes to Medicaid to help assure that Kent County residents will continue to have access to the medical care that they need.
Yeah, the lead program is one that we're watching carefully this year. As you remember, Commissioner Salfeld and Korndike about a decade ago really brought this forward as a priority with support of the board at that time to do more and to end lead poisoning in Kent County. A lot has happened since then. We are at a spot now with funding where we have some questions about whether or not HUD is going to continue to support the program with grant funding. That's an open proposal that's out right now. Also, the Ready by 5 program has funded the program quite a bit, and so we'll see what their recommendations are for funding for the coming year. Collaborative action with healthcare organizations. So we're in a really good spot in partnership with our hospitals and nonprofit healthcare systems. And part of that is due to the leadership of Al co-chairing along with Mike Jannernoa, our executive leadership group of healthcare partners in tandem with the health department and Network 180 and others, looking at big, wicked problems that we can tackle together. We're now looking more at what those issues may be going forward. In the past, it's been things like opioids. It's been the crisis stabilization unit. It's been a number of things that really require that collective action. So we're tackling that now and trying to find out what are the next challenges that we're going to work on together. Substance use and mental health. About 10 years ago, we pulled together our opioid task force. Every year between about 2017 and 2022, we were seeing more than 100 overdose deaths per year. Most of those were related to opioids and fentanyl. We've done a lot of improvement, especially the past 3 years where it's declined every year. I think last year we had 59 deaths. I actually have the most recent summary here. After this meeting, if you'd like to get a copy of it, please do. It's chock full of great tables and data. These changes, though, in the decline in overdoses, along with opioid deaths, we are seeing some increases in things like cocaine and methamphetamines again, and some other things that are concerning. We're seeing the demographics shift a little bit. So we're struggling with, do we refocus, how are we responsive to the changing dynamics and data with substance use? Public trust.
Yeah. So through our programming, our communication, and by listening to the community about their health needs, we're working every day to build and maintain the trust in the community so that every member of our community knows that we are here to support them, their loved ones, and the entire community in this journey to health. And one of those ways we do that is through addressing new and emerging issues.
Yeah, and so I think we all see the headlines each and every day where there's something happening, either here locally or in some remote corner of the world. And people pay attention to those headlines and to all of that conversation on social media and elsewhere, and they have a lot of questions for us. And so I hope you know, and I hope that you feel that we are being responsive to those needs and those questions. We do our best to stay on top of those things. In some instances, there is local public health actionable things that we can do. An example of that is West Nile virus. Generally, we see our first pools of West Nile positive mosquitoes in late July or August. This year, we had our first positive mosquitoes a couple weeks ago. That's really, really early for West Nile virus. So we are working to get the word out about what people can do to reduce risk around their homes. Also, we work with local units of government. Some of them have some larvicide that they kind of hold as their one shot to knock down mosquitoes as they're breeding and multiplying in catch basins in their communities. So we're working to try to bring those mosquito numbers down and get information out there. We don't know if it means we're going to have an earlier West Nile human case or not. Generally, again, the mosquitoes, July, August, and then typically we'll start to see some human cases late August and September. So we're watching very carefully to see if we're going to have earlier cases of West Nile. Relative to things around the world, there's been a lot of talk about hantavirus, and Ebola, and avian influenza, and things like that. With all of those things, they are a significant concern, but they may not be a significant concern to us here locally, but something that we are staying on top of. It never ceases to surprise me now how many travelers we have in Kent County that are all over the world all the time. And whether it was Wuhan province years ago with COVID, or it's Central Africa and the Congo now, we have travelers that are coming here from all over the world, a lot of residents that are doing all kinds of, whether it's business or travel or mission work or whatever it is. And so when persons are coming to an area where there's something going on, we work in concert with state and federal agencies to make sure they have the information they need, that we're monitoring in partnership with them their health, and that if something does develop, that we've got a plan in place with local providers to make sure that it's handled in a way that protects the overall health of the community. So again, that's it in a nutshell. That's a tour of the health department and what we're doing. Certainly we're here to answer any questions or that you may have.
Thank you for the presentation. That's great, and great to have the whole team here involved. I know there's a cast of many more that are supporting, play supporting roles. Questions, discussion? Yeah, Commissioner Oliver King.
Great presentation, and it is close to my heart because I'm an MPHer, and I'm very proud of that. One question I have, where are community dental services happening?
So we have a partnership with My Community Dental Centers, and that's an agreement and partnership that this board has approved, and that works really well where they can get enhanced Medicaid reimbursement rate because of their partnership with us. We have, I think, 12 operatories at our South Clinic location on Kalamazoo Avenue. We have, or they have a separate clinic off of Alpine on 3 Mile, and another one in Cedar Springs, kind of behind where near the highway, kind of behind where like the Wendy's is at, right there. So we also have, of course, Cherry Health and a number of other partners that have added dental services as well. It's a huge win actually for the community. Back in 2011, when we did our community health needs assessment, the #1 priority was dental. We had a lot of people that were on Medicaid who couldn't get access to dental care. Because of that collective work, that's really been addressed, and we don't see that come up in our prioritization recently.
Can I ask another question? Okay, second question. It was great to see that you guys are doing vision and hearing, correct? And so the way that you tap into those children, is that referrals from school nurses, or how does that work again? Can you remind me? Do we still have school nurses? I don't know. Do
I
we
can
still,
answer.
do we still have school nurses? I don't know.
Not every school has a school nurse, but many schools do. So how we do hearing and vision screenings in the schools, we have relationships with every school in Kent County. And at this point, every school in Kent County participates in the program, as does the majority of daycares. So our hearing and vision techs, they're each assigned to a certain group of schools. They reach out to their schools every year, discuss scheduling, different dates, that type of thing, and that's how that process happens.
And if a child needs glasses, do you have a program that you refer them to?
We do. So if an abnormality is confirmed when they do I'm sorry?
I said I went to eye, I'm sorry, you said you were talking about hearing and, so I went to another subject, sorry about that.
Oh, no worries. So the referral process is the same. So if an abnormality is detected during the follow-up screening, the family is notified, and the hearing and vision tech sends a list of referral options, and they also inform the family that if these options don't work for you, you are welcome to follow up with your PCP or any other source of care.
Thank you.
You're welcome.
I'll say, commissioners, we'll do 10, 15 minutes of questions and answers, and I know I'll volunteer. Dr. London, I know, is willing to stick around and have a discussion if you guys are interested in that, but just to be respectful of folks' time. So I've got Commissioner DeBoer next.
Thank you, Chair. I have questions for Sarah. For environmental health, I have two. Well permits for PFAS area. I've heard frustration amongst builders of just the process that is taking forever and, you know, the costs associated with it. Can you take us through that? And my other question is the septic code. Have you guys have a stake in that, or do you have any idea of what you would prefer in some of that discussion?
Great questions. Thank you. I'm going to take the first one. So wells in areas that have known PFAS contamination have to go through a review process, not only through our office, but through the state as well. There's actually a hydrogeological study that's done to figure out whether or not that well would be placed and influence either the plume or be pulling in contaminants into the drinking water well of a resident. I do understand how frustrating it can be for a resident. It's not an easy process. Sometimes the decisions aren't made locally, they're made at the state level for what the outcome is on that, on whether they are eligible to drill that well and put on a filter, or whether they are not eligible to drill that well at all. So it is, I just want to express that. I do understand the frustration. It's a case-by-case basis, and I know it's not a great answer for every resident in Kent County, because PFAS is such a weird contaminant in terms of the way it moves through the water.
So is there any type, I mean, I've heard that people have to, you know, drill down to like the third aquifer. And so is there any type of remediation or like anything that could try to decrease the costs associated with that you see on the horizon coming? Or is there anything that?
That is, you're really on point with your line of questioning. And those are the answers that we've been pushing for at the state level, because they're the ones that actually because we have to be compliant with the state laws and the contractual obligations that we're under with Michigan Department of Ag Michigan Department of Environment, Great Lakes and Energy. So that is a really a big question, is really, I think if I can reshape your question a little bit, is there a place in the world for filters? Because if we're able to accept filters as a viable option for residents with what I'll call an operation and maintenance agreement in place, that it will be operated and maintained to protect human health, would that be an acceptable option? We haven't got a straight answer from the state on that. Yes. So It's complicated. In its premise, the code is great. The biggest issue for the at local government, at the local level, is there's no funding. And it puts a great deal of onus on local health departments to develop and maintain a program without any funding. So, when it first started, if we were to, there's kind of like a plan A and a plan B that you could go as a local health department. And one is that you're basically like an oversight committee of these private inspectors going out and looking at people's septic systems. And then the other one is the health department operates it, and they do it all. Both are extremely costly. For Kent County, I think at last estimate to do an oversight committee, it would be about $2 million investment. The state has done a really good job of outlining what it would cost at the state level and asking for that amount at the state level. But when you read the fiscal analysis of the bill, it says financial impact undetermined and detrimental to local government. So what they want to do in the bill is actually really great public health. It really is. There are questions that concerns that kind of come to mind with whether or not about access and getting access to people's property and things like that. There are other like little nuanced elements of it that I have concerns about, but overall, the bill is really a great bill if it had funding.
Yeah, and just add that it's a really good question. It's something that has a lot of different thoughts from our profession. Yes, Michigan can do better in terms of protecting its groundwater resources. We're the only state that has a sort of patchwork of regulations. But we've got some pretty significant concerns about the bill that's been proposed in the legislature right now. Sarah touched on them a little bit. Funding, and also we're concerned that any mandate that forces county staff onto people's property without their invitation is very, very deeply concerning to me. And so that needs to be dealt with. Also, we need to make sure that that these programs are sustainable, and that we maintain local control over some of the hows. So I would prefer a system where the state says, here are the performance standards. Counties, you figure out how to make that happen, instead of here's a prescription for the systems you have to install in these environments, because every county is so different.
Thank you, I appreciate that perspective.
Yeah, and if I can just add one more thing, is that they had a committee meeting, a Senate committee meeting on the Senate bill that was introduced. I think it's 7701 is what I have in my head, but I could be wrong. It might be 770. But they just introduced this week a House bill for this legislation as well, that is actually one page shorter than the Senate bill. So I've got to do some investigating to figure out what kind of was taken out.
So I'm not going to put anybody else in the queue. We've got 1, 2, 3, 4 people, so we've got a little bit to get through before we get time here. So Commissioner Ponstein is next.
Thank you, Chair Green. I'll try to be brief. I just want to thank you, first of all. I mean, the health department, you could describe which one is the most large in size in the county, but what the health department does and the tentacles that goes out into the community is just remarkable. I mean, a person cannot get up in the morning and go through the day without something that happened or they experienced that had to do with the health department. Whether it's, I go to work and there's 50 or 60 people that just are all tattooed up. And most of them never realized that there was someone there to make sure that procedure was safe. It's just, incredible. Secondly, I do get some interesting calls from constituents, not just in my district, from all over. And I think over the past few years, food trucks, issue on raw milk, food service inspections, a water well permit that they weren't having problems with, but they just needed a nudge to get it going. So, I mean, every time I've called the staff, what's really is nice is that one is the call's taken promptly. I get information up front of why this might have occurred. And then when the result is out there, I get a follow-up call. So as a commissioner, I really are, thankful for that. But yeah, going back to the beginning is the strategic plan for our county, safe, health, and, recreation. I've got a hobby of following the group, the Blue Zones, and they track communities where people live to be 100. And that is certainly a goal for me. And one of the big things that they have found, not so much diet, but believe it or not, it's movement.
Yeah.
People that move around, whether they walk to get their groceries or they exercise, or they're walking with more than one. But that's all important. But, those tentacles are all together is, if we're going to have a place for people to move around, they've got to be healthy and they've got to be safe. So I appreciate everything you do. There's no real question, but it is important. But when you have an organization that reaches out in so many ways, there's times when conflicts can occur and disagreements do occur. And, we've got, food's always been important to me, whether you agree with Robert F. Kennedy Jr. or not. He's put at least the conversation started, and a lot of that's good. I'm not going to agree with him 100%, but I appreciate it. You guys face a lot, but it's important. Health is number one for people, and if we're going to have people in this county living to be 100, we're going to need partnerships. So thank you all, and I mean that from the bottom of my heart. Thanks.
Thank you, Commissioner, and I'll pass that along to our team. We do have almost 300 employees who really do care passionately about Kent County and the health here, so it's, and lots of unusual calls that we receive also, and we help people every day, work them through it. So.
Thank you. Commissioner Steck.
Thank you, Chair Green. First, acknowledging the chair for this format. I think this is a much better format for us to receive the kind of information that you have than cramming it into a special order in a board meeting. A couple of questions. First, on the septic system. Is the percentage of septic systems, or I should put it differently, are the percentage of homes that are on septic systems increasing or decreasing in this county?
Good question. As a percentage, I don't know. Altogether, we have, about 100,000 septic systems in Kent County? And so that number is increasing. I'm not sure how it is relative to those who are on municipal, but.
So the absolute number is increasing?
Yes, it is. And we're very fortunate in Kent County that we have a lot of high sandy geology. A lot of places don't have that, and so we do have areas that are well-suited geologically for septic systems. The challenge we then get is the conflict in agriculture and preservation and a lot of those values moving forward.
So my follow-up question on septics is, since I've got several of them, is the science on septic systems pretty much the same as it was 40 years ago?
Yeah, it's changed quite a bit. It really, there was a philosophy in the time that was really about disposal and just getting rid of the sewage. Since then, it's really disposal plus treatment and understanding what's happening biologically and chemically in the ground to make sure that water, that wastewater is being broken down so that by the time it gets into the aquifer, it's not a threat to drinking water supplies. And the science there has evolved a lot in the last 40 years.
So is the target, one of the objectives then at the health department, not only is to see whether systems are failing, because old systems fail, but also mechanisms to upgrade these systems?
To make sure they at least meet a minimum standard
Okay.
for performance. And failing 30 or 40 years ago would have been, is it on the ground? Is it discharging directly into the groundwater?
Is there water on your yard? Yeah.
Exactly. Does it stink and do you have flies and all of that? Now it's that plus, when it goes away, is it contaminating, polluting something, whether it's the river, the lake, or the groundwater?
I just have a sense that these septic systems are sort of that hidden big risk in our county because they function or they dysfunction, and there's so many of them out there, and they sit there until you sell, and then the problem surfaces. But well, thank you for your work on that, but still some things to do.
Yeah.
The second question I have is, we do monitor food systems. I didn't hear any mention of the new method of feeding your family, which is a daily, weekly meal that's prepared and delivered by mail to your front door. Do we monitor and supervise or have anything to do with that?
We do not. I believe that is all through the Department of Agriculture and, USDA.
So we have nothing to say about the quality of those meals that show up?
Correct.
Okay, I'll remember that.
That's one, don't call us on that one, so.
The third question, there was no mention of homelessness. Now, you and I have had conversations. Homelessness is, to some extent, a health issue as well. What's the role, if any, that the health department has in dealing with that?
As a collaborator, we don't have a housing program, but we certainly recognize that housing is an upstream precursor of so many of the problems that people face, whether it ends up deteriorating into substance use, mental health, suicide, poor academic outcomes for the kids, all of those things. So we do encounter homelessness in some of our programs, especially in some of Christina's programs with moms and babies. And, when our nurses are visiting someone in a different location for each of their appointments, that's not a great environment for mom, for the family, and certainly for the baby to grow up in. So we work with a lot of our partners, as you know, to try to do what we can, but we don't have a direct housing program at the health department.
All right. Last question / comment. As we go through this, the health department, probably maybe as much as the sheriff's department, but you have a lot of power in that department. And that power can have significant impacts on the lives and the businesses and the operations of people across the county. And I know that you are uniquely aware of that. And that exercising that power requires a high degree of understanding and sensitivity to how you do that. And I want to acknowledge you for doing that, your department for doing that, and particularly drawing some significant lessons from some of our experiences in the last 5 years have matured your department and matured you in ways that we probably wouldn't have been 5 years ago. So I acknowledge you for that.
Thank you.
Commissioner LeGrand.
Thank you, Chair. I have a comment and a question. My comment is, I love it when I get to be kind of a secret shopper. And recently, in my big old, maybe slightly drafty house, we had a bat. And it spent some time with a visitor from outside the country who was very nervous about this. We were able to get the bat, kill the bat. But we took it for testing since there had recently been a bat that turned out positive for rabies in Grand Rapids. And we got the results very quickly. We got great advice on getting it there to get it tested the quickest way possible. And he got the answer before he went back home. And it was not rabid. Anyway, it was really great to have such quick professional service. So thank you. And then also I want to thank Brian and his team for the great work they do on the CHNA survey. It's really impressive, and it's a federal requirement for our nonprofit hospital, so you really do just have a huge role in the backbone of the whole medical system here by helping complete that. But I do have a question, because I tried to scan the QR code to lead me to the survey, and I didn't get there. I got to a whole page about it. Maybe it's the mobile app, but I wonder what's the best way to get to the survey itself, because I would really like to share it.
Yeah, thank you for that comment, and thanks for sharing our CHNA. So right now, the CHNA is not active.
Oh, it's not.
So what's on there is probably old, and it was for soliciting people to participate in helping to get the survey out there. So we're targeting probably middle of this month, later in this month, for the survey to be active. So
Okay.
it'll be a little bit, but we'll definitely let you know.
Keep us informed.
Yes, yeah.
Thank you.
Thanks so much.
We'll be very loud when that
Okay.
happens, because we really do want every corner and every person that's possible to respond to that.
Okay, thank you. Thank you, Chair.
Commissioner Pakla.
Thank you, Mr. Chair. A kudos and a question, and I'll be brief with this. The kudos is, pursuant to your statements about trust in the community, the emails that you all send out, especially about hantavirus, Ebola, that have gone out recently, I have had a number of conversations with constituents that they are very reassuring, and that they are reassured by the information that's in there, right? And so the ability to have that very clear communication about what is going on, what kinds of concerns our residents in Kent County actually need to be concerned about, and to have it be something that's so accessible to everybody is just such a phenomenal resource. So kudos to everybody in the work. The question is, and we just sort of talked about, you know, the backbone organization that the CHNA, exists as. I've been hearing a little bit more about community information exchanges, CIEs, coming out of MDHHS. And I'm wondering, is there a role that the Kent County Health Department can or is in conversations and planning about CIEs, collaborative conversations around that? I'm just sort of curious about I think Kent County is not currently in possession of a CIE, and so curious about how we can leverage our position at the county to support exchanges.
Yeah, great question. And we have been involved in some conversations around that with Health Net of West Michigan, who unfortunately, just recently folded, United Way, with their social navigator system in 211. So, but the health department actually received some funding from the state in the past couple of years to start developing a CIE. So we are actually in a pilot phase right now with connecting our electronic health record with United Way system. So people come into the health department in our maternal infant health program, and they go through a social needs screener. And if they're identified as having transportation and food access needs, they're automatically referred down electronically to United Way for their food access program that they have. So yeah, we're at very early stages of it. I think the challenges of that are funding. We got a little bit of seed funding from the state, but to coordinate that with the backbone organization and all the technology that underlies that process is very expensive. So we're working with Muskegon Access Health Muskegon has a great system in place, Jackson County. So we're learning from those counties who have a system in place, but really it's just capacity and resources to get that going. Yeah.
All right, Commissioner Hennessy slid in after I said there were no more. So this is going to be the final one, Commissioner.
It's
Yeah, she's, yes. Ranking member Hennessy. Yeah.
Following up on Commissioner LeGrand's question, can you provide additional perspective to this whole report of a rabid bat and its importance to our community? And I've had a call from one of the townships on someone had a bat in their room and they didn't capture it, but just provide some perspective to that.
Yeah, well, I could probably talk about bats all day because I've had some bat encounters in my own home. And I know how scary that is for a person when they wake up with the squeaking in there. Yeah, Commissioner Merchant has had some of these experiences as well. So it is a concern because bats can often, especially when a person is sleeping, can have contact and can have a bite, and their teeth are so small that a lot of times a person doesn't even notice. And there have been some horror stories out there where a person doesn't realize they were bit, and rabies takes a while to develop. The onset can be months, and weeks or months later, a person has rabies. And once rabies, the symptoms onset, it's like a 99% fatality rate. So it's a very, very dangerous virus if you do get it. Most bats don't have it. They're not carrying it. From year to year, it varies somewhat, but the bats that are tested, usually about 5% or so that we test are positive. Most of them don't have any contact with humans, but we don't know that they're not. So, out of precaution, we always make sure that we want the bat tested. And if the bat can't be captured or can't be tested for whatever reason, most providers will advise and recommend to move forward with the rabies prophylaxis, which thankfully is available. A little expensive, but it is available. It's very effective at preventing rabies if an exposure has happened. And the same is true if it was a bite from a skunk or from a raccoon or from a dog or something that had rabies. So I think the important takeaway here is if you wake up with a bat in your house, don't just shoot out the window. We really want to have it captured, carefully, safely captured and tested, and then contact your doctor's office to follow up on whether or not you're at risk for or should get the prophylaxis.
Well, I'm glad we got that in, Commissioner. I didn't know I needed another thing to live in fear of, thing that can kill me, but we're here. Yeah.
Yeah. Both
Great.
the bat and the rabies, both. It's like
Yeah.
a double layer of fear.
Uh-huh. Well,
Yeah, most bats are good, but when they're in the house, they're a problem.
it's the rabies. You need them on the West Nile. Anyway, listen, I appreciate it very much, Dr. London. You guys do really important work. I want to thank the team. It's not glamorous work, we know that, but it is critical. It's really important. We know it's also pretty thankless, so please share with the team, all 300 of you, that you have our thanks So we really appreciate it, and thank you for doing this today. That's all I have.
Thank you, and appreciate all of you.
Thanks very much. Any commissioner comments? No, there are not. We are adjourned. Thank you, everyone. We appreciate it.